Welcome back to 22 News in Focus. Today we're talking about skin cancer, what it is and what you can do to prevent it. Joining us now, we have a Northampton resident who survived her battle with skin cancer and now has dedicated her life to raising awareness about this deadly disease. Meghan Rothschild, you are the creator of Surviving Skin. Thank you so much for joining us.
Yes, thank you for having me.
Well, you were just listening to John O'Brien's story as well. Yours is a little different. You actually, were diagnosed with this at a much younger age, actually. Can you take us back? Tell us your story.
Sure. So I was actually diagnosed at the age of 20. I was in my sophomore year at college, and I had found a mole on my stomach that was really, really dark. John mentioned something about itching. My mole had started to itch as well. And I brought it to the doctor's attention and said, I'm kind of questioning this mole, this spot on my stomach. And to be honest, she looked at it and said, it looks fine. I don't think you need to do anything with it.
Really?
Yes. And I said, I have a bad feeling. You just have that feeling where you think, no, I need to pursue this a little bit farther. So I, really kind of pushed to have it removed. And I came back a week later to have the stitches out. And the doctor came in, and I remember him asking me if there was anyone in the waiting room that he could go get to be with me. And I was there by myself. I'm 20 years old, sophomore year of college. I'm thinking, oh, I just got a mole removed and I'll be on my way. Mm-hmm. And it was then that he told me that I had melanoma.
Wow. Had yours spread? John was saying that his had actually spread already. Had yours spread?
No, mine was at a stage 2.
Okay.
But because of the depth of the mole, they did urge me to take lymph nodes to make sure that everything was okay and that it hadn't spread, progressed to a stage 3. So I did have to go through a pretty intensive surgery where I had 7 lymph nodes removed from under my left arm and 1 from under my right. They did what they call clear the margins, which is they go in and they cut a huge chunk of area out around where the mole was located. And they actually took an area where another mole had come back as severely dysplastic. So I was in surgery for about 3 hours, came out with about 75 plus stitches.
Now, wow, 75 plus? Oh
Yes.
My gosh, that's a lot.
Lots of major scarring. I had drainage tubes sewn into the incisions to make sure that I didn't swell or have any type of infection. And I wasn't really prepared for that when it hadn't really, they didn't think that I was going to need all that. So when I woke up, I had netting all the way up to my neck, and drainage tubes had been sewn right into the incisions. I had to empty them every 3 hours.
What was going through your mind? You're a sophomore in college. This was not in your game plan at all.
Not at all. Immediately upon my diagnosis, the first thing I thought of was, you're an idiot, you did this to yourself. And the reason for that is because I had made poor behavior decisions, from age 17 on. And then when the doctor uses words like cancer and survival rate and starts throwing out all these big medical terms, you're exactly right. This isn't in my plan. Yeah, this isn't happening. This couldn't have happened to me at age 20.
Mm-hmm. So can I ask you, were you going in tanning beds? I mean, what were your activities that you must see other people doing also?
I was big into the tanning booths. I started that habit when I was 17. Didn't like having a fair complexion at all, wanted to always be dark. I could never obtain a tan in natural sunlight. I would maybe burn, get a little pink, or get splotchy, but I could never actually get a tan. So I actually had spoken with a nurse who had told me that tanning was a safe alternative and I could use tanning booths. And so I started that habit, and I did it for 2.5 years, about once a week.
And you're not alone. I mean, you're not the first person to, make tanning bed, go to a tanning salon in their daily routine to do this. You must think of it a little differently now, do you?
Oh, of course. I mean, I take any opportunity I can now to tell people to stay away from tanning booths, to wear their sunblock. And I think back about what I was doing to my skin, and there was always a part of me that was thinking, skin's the largest organ in our body. This probably isn't a good thing to do, but when you're 17, 18 years old, you have this sense of invincibility, and you don't ever expect to get a cancer diagnosis at the age of 20.
No, you never think it will happen to you. Did you have skin cancer in your family? Did you have any reason to have this on your radar?
I did not have melanoma in my family. My grandmother had had a few basal cells removed, but she was in her 90s. Late 80s when that started to happen. So there was no history of skin cancer, any type of melanoma skin cancer. So it wasn't something that I talked about with my doctor on a regular basis.
Okay. without giving away your age, I guess, how many years now has it been that you've been keeping it? How frequently do you go and check your skin? What is your routine now?
Well, my routine now is I go twice a year. Right after my diagnosis, I was going once every other month. So I was seeing a dermatologist about 6 times a year. Now I've been given approval to go back down to just twice a year, and eventually, someday, I may get back down to once a year, maybe. But, you know, as John was saying, once you've had melanoma, you're at a greater risk to get it again. So it's not something that you can say, oh, I'm over it, and now I can move on. It's really a lifestyle that you have to adhere to make sure you prevent another recurrence.
At this point in time, would you even want to go down to once a year? I almost feel like that would be like a hard thing to do once, you know what I mean?
Oh, absolutely. I don't think I want it. I think... I don't know if I'll ever be comfortable with once a year. I think it's always going to be twice a year for me, just because if there's something on my skin that I see that I want taken off, I have a hard time even waiting until my 6-month appointment. I just want to go in and get it taken off, because it's not worth waiting, you know.
And doctors feel like you're in a good position right now. What is your current situation?
I'm free and clear. I have been for over 8 years of cancer, so doctors are optimistic. You know, I was really young when I had it, and my diagnosis mainly was caused because of what I was doing behaviorally. So doctors are optimistic that, you know, I'm being vigilant about it. I'm wearing my sunblock. I'm taking care of my skin now.
It's interesting. I mean, you've been very blunt and you've been very public about it. I used to go to tanning salons. This is what I did.
Right.
And then it's interesting to hear from someone like John where he was, but of course, maybe he just didn't use SPF all the time. You know, it really can happen to everybody. You always have to be careful. Talk to us about surviving skin.
So after my diagnosis, I was actually going to college as a journalism major, and I had done some writing for a local magazine, and they asked me to kind of do the story as a first person, talk about my experience with skin cancer. So it was my first, it was about a year after, it was my first time sharing publicly my story. And, you know, John said it's cathartic to talk about it, and it's a form of therapy. And so I did that, and it received such positive feedback. I had a lot of people emailing me and a lot of people thanking me for sharing my story, that I realized that maybe this doesn't need to be a negative. Maybe I can turn this into a positive. So I started speaking on the topic. I visit, you know, area colleges, high schools, senior centers, pretty much anyone who will listen. I go out and I talk to about making sure that this doesn't happen to you or someone in your family. And that's really what Surviving Skin is all about.
And this is actually a nonprofit. So, I mean, do you have a team of people that work with you? Or?
It's just me. It's a sole proprietor. I actually work, I'm on the board of directors with the Melanoma Foundation of New England. So any fundraising that I do is directed to the Melanoma Foundation. So I just kind of go out and do the speaking engagements on my own. I've had interns in the past, but it's not a full-blown business.
Well, that's great. Still, it's a wonderful cause that you're doing. You're getting out and talking to people. You know, you were talking about this, you know, pressure when you were young to look tan. You wanted to be tan, right, you know, for whatever, you know. When you watch shows like, you know, they have on MTV or the Jersey Shore or anything like that, this is still something that's happening all the time. There are people who, you know, just have to be tan, and it's a cultural thing, and that's just the way it is. What are your thoughts on that? I mean, is this something that you talk to people about when you do make these visitations?
I always bring up Jersey Shore.
Really?
I do. It's such a phenomenon, pop culture phenomenon, and you know, I always talk to people about it. In a way, I'm almost grateful that they've brought this whole tanning thing to the center of attention, because a lot of people look at it and think, oh my gosh, they're being so excessive, or this is ridiculous, they look too dark. So there's a positive that they're bringing attention to it. The other thing is you know, I do watch that show, and I've found that they do a lot of sunless tanners or spray tanners, and that always makes me happy to see that there's some alternatives. But I always bring it up at my speeches, because it's certainly not someone you want to model your behavior after. And I think people know that. I think people understand that this whole Jersey Shore phenomenon is not a route you really want to go down.
Earlier on in our program, when we had Baxton O'Brien, co-host John O'Brien on, he was talking about how, you know, younger people may not hear his message just because it's hard to get that message across. Do you think that you have an ability to get that message across? You know, what are some of the reactions that you get when you talk to younger people about this?
Well, I think that when I go out and I speak, and I will tell you I don't remember a time where I haven't had a question asked during one of my presentations, or I haven't had someone approach me after a speech. And whether it's a young woman coming up and saying, I'm never tanning again, or I heard your presentation last year and I haven't been tanning since. I had a young man just a few weeks ago come up to me and tell me that he was thanking me for being there because he was immediately leaving and calling his mother to talk about his mother and his sister's behavior and how they were tanning. And I actually saw him the next day, and he told me that his mother made him a promise that he would prevent his sister from using a tanning booth.
Wow.
So I think that because it's a personal story, because I was diagnosed at the age of 20 in college, that I do have the ability to relate to the students, and they can almost see themselves as me. And I know that a lot of people, when they hear my story, a lot of young women immediately start to get nervous and start to worry because, you know, I can see them checking their skin in the audience and they're pointing to their friend, and then they come up to me. And so I don't mean to scare them, but I think my story has the ability to kind of change their behavior a little bit.
You almost do mean to scare them, you know?
I do.
You almost,
there's a part of me that enjoys that.
such a nice person, but I think that's almost how you get that message across, is to scare people. Do you think that more needs to be done in schools to educate students on this?
Absolutely. I think it needs to be a part of every health class curriculum starting freshman year. You know, I remember going to many seminars where people had come in and talked about chew tobacco or cigarettes or alcohol, safe sex. Kids get all those messages, but nobody's talking about skin health. And melanoma is the second most common form of cancer in young people ages 16 to 29. We have to start talking about this with the kids at the age of 14 or even earlier. So it needs to be integrated as part of the health education curriculum.
Well, it's become common when you're getting ready for prom or a homecoming dance. You know, you'll go tanning. I mean, do you think that there's any way to get that through their minds that this is not something? Is this a cultural thing that you see going away in the future?
I do. Luckily, I think tanning beds and this whole phenomenon of tanning is the cigarette of our generation.
Wow.
I think that in 20 years we're going to look back and think, oh my gosh, but remember when we used to do that and we used to think it was safe? And I think that giving kids alternative, there's so many options out there, spray tan, sunless tanners, enjoying the skin that you're in, that if we start teaching them at an early age, it may resonate with them. And when they're old enough to make that decision, they can hopefully, they'll think back and think, you know, I've already heard that this is a bad choice, so I'm not going to do it.
And fair skin is nice, too.
It is. Lots of celebrities are embracing their fair skin nowadays.
Meghan Rothschild, you've been wonderful. Thank you so much. And you really are reaching out to so many people. It's always wonderful to hear what you're out there doing. Thank you so much for joining us and sharing your stories.